Good morning, everyone. I'd like to first thank you for joining us this morning as we update our community on our efforts to fight the terrible virus that has had an unimaginable toll on our community. I want to begin by first thanking our Chief Health Officer, Dr. Ernest Carter, who is here. You will hear from him soon. But I'd like to offer my heartfelt thank you to him and the entire health department team for the heroic efforts that they have made and their dedication to our community. I also would like to offer my condolences to my colleagues in the health department. We unfortunately lost one of our colleagues to COVID-19 this week. This particular death has had a serious toll on our colleagues there, and I want to offer my heartfelt condolences to the family as well as to our other colleagues who are at the health department doing their level best to get us through this crisis. I'd like to also thank Congressman Anthony Brown, who has joined us this morning. I want to thank him for his hard work and our entire delegation for the work that they have done to make sure that we have the critical resources that we need here in Prince George's County as we seek to restore and recover our health and our economy. As you all are all aware, Governor Hogan announced yesterday that his stay-at-home order will be lifted with restrictions still in place on crowd size, facial coverings, and social distancing. He also announced that the counties may keep restrictions in place if they are not ready to open. I can tell you that as of today, Prince George's County has more than 10,400 confirmed cases of COVID-19, 356 deaths. We are not alone as we look around the region. Maryland's cases continue to climb. We've noticed, I've been hearing about the District of Columbia, our neighbors also in Northern Virginia. And so we are very much still in the thick of this virus. We are seeing the case counts are increasing. We're seeing that hospitalizations have likewise not declined. We are averaging in Prince George's County 9 deaths from COVID-19 per day. This is an astonishing number, 9 COVID-19 deaths per day still in Prince George's County. And what this means is that this has quickly become, in the 2 months plus that we have experienced it, the leading cause of death in Prince George's County. So needless to say, Prince George's County is not ready to go to phase 1, and that we are at this point taking advice from our public health officials. We will continue to work closely with Dr. Carter, the health department. We are also receiving ongoing advice from the leadership of the hospital systems in Prince George's County, who we talk to each week, and we will continue to follow their advice. We've been in contact, as I mentioned, with those hospitals who we've met with, who tell us that we normally have a total of about 81 ICU beds available in our hospitals. We have had to increase the capacity to accommodate 113 ICU beds, with 70 of those are COVID-19 patients. We are also operating on average at about 80% capacity in our ICU units. This means that we are operating now at least 40% over what we are accustomed to in our ICU units across our hospitals. Just this past weekend, we reached a new high of 192 COVID patients, positive COVID-19 patients in our acute care in our hospitals. And although we've seen a slight reduction in the growth of cases, what we need to see, Dr. Carter has said it before, that we need to see a steady decline in our hospitalizations and other numbers before we feel comfortable moving forward. Finally, we have the highest positivity rate in the state for testing. 1 in 3 people who we test here test positive for COVID-19, while the state average is 1 in 5. What that means for us is that we have been very successful, and I want to compliment again the health department who have really adhered very strictly to the CDC guidelines, which tell us which individuals are appropriate for testing. We have followed those guidelines, and that is the reason that we believe that we have seen those positive cases. But what it also means is that we have, unfortunately, a good number of asymptomatic individuals who are walking around our community every day, because we test generally individuals who show up with symptoms. That's been what our testing capacity has been. We have not had the capacity, and what we will need to have the capacity to do in order to move forward safely is to test also asymptomatic individuals before we can trust that those folks are safe to come back into our government buildings, before they're safe to come into your workplace. We have to be able to test for individuals. Needless to say that this is so serious. And Prince Georgians know it's serious because for us, these are not just numbers. These are our family members. These are our neighbors. These are our colleagues. These are people we trust. When we say over 10,000 plus who are sick and nearly 400 who have died, these are people we love. And these are our relatives who are risking their lives also to respond to the call, the frontline workers, the essential workers, the ones who, when you call the ambulance, show up every single time to our households. The people who are driving these ambulances are our family members. And I have been so heartened by their stories and their courage. And I just thank them so much for showing up every time. And I'm hearing likewise about the frontline workers who, at this point, are standing at the bedsides of our sick relatives and friends who often are holding their hands when they pass away because our family members are not allowed to be in the hospitals right now to comfort those who are sick and afraid, who are not allowed to be in the hospitals next to their loved ones as they are transitioning. And so this is a very serious time for us, and I am so heartened by the courage of those who show up at work every day in spite of the risk for them. A recent story also moved me, and that was an 81-year-old woman who called our office and said, listen, I need you to contact my children and my grandchildren. I live in an assisted living facility, and I want to see them. I miss my family. And they tell me that you said they can't come visit me. I have a grandchild who's beginning to talk. I want to see her. Can you please call my family and tell them it's okay for them to come see me? We were so brokenhearted that we had to tell her, you know what, your family is right. It's not safe for them to come see you because guess what, right now it's not. And so that's the reason that I am signing an executive order to issue a stay-at-home order for Prince George's County that will be effective through June 1st. This will effectively extend what was already put in place at the state level. And what this means is that we must continue for this period. Dr. Carter tells us we need at least 14 days to assess where we are before we make a different decision. And so we are giving ourselves that time. And what that means is in the interim, we need you to please continue to stay home, except for essential activities like going to the grocery store, picking up medications. Remember, going to the emergency room is always essential. Remembering again that we were hearing those warnings that too many of our Prince Georgians were afraid to go to the emergency room and were having heart attacks and other critical medical emergencies and staying at home. We don't mean to stay at home in the case of those kinds of emergencies. We know as well that you must at times visit relatives to take care of them. And so other than those activities, we want you please to stay at home. Non-essential businesses are not reopening at this point in our county. Restaurants will be able to provide delivery and curbside pickup. We want to encourage that. Again, the delivery and curbside pickup, we are agreeing to that. And it pains me deeply also to say that our churches and other religious facilities that are holding virtual, that must continue to hold those virtual services because our health officials tell us that it is not safe for us to gather in larger numbers. And so we understand also that the very nature of church is to gather, to be together in prayer. But right now, our health officers say that it is not safe to do so. And so until we get a different signal, and again, we're going to reassess this over the next 14 days so that we might make a different decision. I know also that this decision will impact our business community, and I want them to know that I understand that you are hurting right now. The economic devastation is absolutely unbelievable. I am so concerned, deeply concerned, about the impact that this virus is having on our business community. We are so disappointed about the jobs we lost, and the reason that we say this is because we know how important it is to create jobs, because no one in the state has done it better than Prince George's County over the last 5 years. In fact, we work together as a community to create more jobs than any jurisdiction in Maryland over the last 5 years, year over year, consecutively for the last 5 years. And we lost all of the jobs that we created within a month of this virus. And so we understand that the small business community is the backbone of our community. It means that we're going to have to continue to work together to restore and rebuild. We are absolutely committed to doing that. That's why we launched our Business Relief Fund. That fund is still accepting applications through tomorrow, May 15th. We anticipate also that we are adding additional funding. I want to thank the County Council. I want to thank its leadership, Chair Todd Turner. They are in session right now, but I want to thank the County Council who have allowed us to double the fund in the Business Relief Fund. We've gone from $10 million. We have now increased it to $20 million, and we'll continue to do everything we can to help our business community weather this storm and to restore and to get back to some normalcy. Right now, the science tells us that if we open our doors at this moment, not only will we lose additional money, but we're going to lose more Prince Georgians. And that, I have to tell you, I have a duty to make sure that we are not only protecting livelihoods, but we also have to protect your life. And so Dr. Carter will discuss in a moment the metrics on which we need to see before we can safely reopen. But I do want to make something clear. I know that people want to get back to work. Trust me, I want you to get back to work. I know that people want to gather again with their families. Trust me, I want to get together and gather with my family again too. I know that this has come at a great sacrifice to Prince Georgians, to our business community, that we have sacrificed so much, but quite frankly, we can't reopen because we don't have the resources that we need to do so safely. What this means is that we have made certain requests and that we have not received the resources that we need to safely reopen. I want to thank the state of Maryland for the seamless communication that we have had. We've enjoyed that communication. We stand ready to partner with you as we always have, but we need the state to do its part. Put simply, we need the state to do its part. Just like it is the federal government's responsibility to make sure that the state has the resources it needs, so it is the state's responsibility to make sure that all of these jurisdictions likewise have the resources that we need to be able to move on and to open our jurisdictions safely. At this point, we don't have it. We do not have the gowns that we have needed. We do not have enough PPE. We don't have enough tests to expand the capacity for what we need. We don't have enough contact tracers. And these are metrics that were set out by the governor. And what I can tell you is that Prince George's County at this moment does not have the critical resources that will be necessary for us to meet those metrics. Prince George's County residents are not just Prince Georgians, they're Marylanders. And what this means is the truth of the matter is that if Prince Georgians are sick, so is the rest of the state of Maryland. And so please, we need to continue to work together. Again, I want to thank the administration for the seamless communication, for the willingness to work with us. I have also been in constant communication with my colleagues from the other larger jurisdictions in the state of Maryland, the other county executives. We were on the phone until late into the evening last night. But again, the populations of Prince George's County and Montgomery County in particular make up a third of the state. Right now, that is where the crux of the cases are. We likewise make up 40% of the state's economy. Unless Prince Georgians and Montgomery County's residents are healing and well, the rest of the state likewise will suffer. And so it is in everyone's interest that Prince George's County is able to safely reopen and recover from this virus. And the same is true for our neighbors in Montgomery County. So as I've said last week, we will take a measured and smart approach to reopening non-essential businesses and resuming gatherings with our family and friends. That's why today you'll hear Dr. Carter talk about the 5 pillars that will set the foundation for our reopening. These 5 pillars are in alignment with the governor's Maryland Strong Roadmap to Recovery, and they are as follows: reducing the curve, healthcare system capacity, adequate testing, needing contact tracers, and more PPE. And once we are able to meet these measures under the pillars, we will be able to move forward with the initial stages of reopening Prince George's County. Dr. Carter will provide some data on where we are with respect to these metrics, but what I want you to know is that we have not yet met the metrics, although we have worked very hard to make sure that we can get there. You heard me say last week that God bless the child who has its own, and so we have been waiting patiently to receive the resources that we've needed, but we haven't stopped there. And so we have not only requested an additional 3,500 tests per week from the state of Maryland so that we can open up additional test sites in the county, with at least one additional site in the northern part of the county and one additional site in the southern part of the county. But we have also gone about securing our own resources and are at this point nearing the limit of what we are able to acquire from entities outside of Maryland. And so you'll hear from Dr. Carter about those efforts, but we are working along with our health department and the Office of Emergency Management. I'd also like to thank Jonathan Butler from our Office of Community, from our Office of Central Services, who has done a yeoman's job in trying to secure all the supplies that we have needed throughout this, and Ronnie Gill. But our goal is to phase in a reopening once we have been able to stand up the sites over the next 30 days, to get appropriate personal protective equipment, to have the testing supplies, because again, we can't send people into businesses without the ability to test them. We can't bring these people back into government offices, into any of these offices, without the ability to test them. And so we have to be able to expand capacity there. We're also continuing our efforts to make sure we cross-train individuals. So we're using every resource we have at our disposal. The contact tracers, we're not waiting. We are now working with some of our employees inside Prince George's County government to train them to act as contact tracers who are working in other capacities. So we're still continuing to do the cross-training to make sure that we get to where we need. And so I know that all of this is hard. I'll say in conclusion that these are really, really trying times for all of us. I have said to you before, I will say it again, coronavirus will not have the final say in Prince George's. This is a time where we will have to reimagine what our new normal will look like, because we know as a result of what we have experienced, we will have to do business differently than we have in the past to make sure that we're able to operate safely. We'll build that new normal together. We'll rebuild our businesses. We'll make healthy our family members. We're going to make sure that we rebuild our community in a way that puts it back where it belongs, and we're going to do that work together. But for now, I ask you, please, to make sure that you adhere to the advice that has been given by our health professionals who are leading us in this effort. We are taking advice from medical professionals who will keep us alive and keep us healthy, who say that we have to continue to keep the facial coverings, who tell us that the social distancing is still as important as ever, that as the weather warmed up and the temptation will be there for us to gather in large gatherings, it is still unsafe for us to do so. And then I also want to say, before I finish, one more word about the church community. Everyone knows I love to worship. And so I have missed, like everyone else, the opportunity to come together as a community. And right now, our faith community in particular has done a yeoman's job in providing for us, as they always have, food. They have been in these parking lots all throughout the week, even today, providing meals to those in our community who need it, who are providing the other mental health care and the other things that our communities have needed. And I urge you also to provide your help and support to them. They will be critical, as our business community will, and all the others. They really do make up such an important part of our community that I urge all of you to continue also to support them as they rebuild and restore. And so thank you all so much. I'm going to turn this over to Dr. Ernest Carter, and I say to all Prince Georgians, hang in there. Morning is coming. I will continue also not only to work but to pray for all of you and your families. We're going to make it through this together, and we're going to be stronger than ever when we make it to the other side. So thank you so much.
Thank you, Madam County Exec. Before I start, I would like to offer my heartfelt condolences to the family of our fallen employee. She was an excellent employee. She stepped up to the plate, and I just want to say. So good morning. This past weekend, we hit our highest mark so far of 262 people with COVID hospitalized in Prince George's County. But in the past several days, we've seen a steady decline in that number. It's now 204, and that's encouraging. Now, at the same time, however, all of our hospitals are still operating beyond their normal ICU bed capacity. To go from 81 ICU beds, now we're averaging about 113 ICU beds occupied per week. This is an enormous challenge for our hospitals, and they're stepping up to the plate with all the courage. So we appreciate that. Now, the good news is that we expect our ICU bed capacity to start to increase and keep increasing. As you all know, Laurel Hospital is opening up additional ICU beds, and temporary structures outside of our county hospitals are becoming operational. For our acute care beds, as the county executive said, we hit a new high last weekend with 192 COVID patients in those beds. But since then, we've seen an improvement. At last check, we had 136 acute beds in use. This needs to keep going down, and we're checking it. We're also beginning to see a hopeful trend in cases. The rate of the increase of our cases has been slowing down consistently week by week. And we're hopeful that we're getting toward a flattening. We will see. We'll keep checking. We're seeing good signs, but we're not quite out of the woods just yet. Our case count still is going up. We must meet certain measures before Prince George's County is ready to reopen. Let me go over them. There are 5 of them. First, we must reduce the curve. What does that mean? There's 2 measures that we have to look at. We must have a 2-week decline in new cases. And we must have a 2-week decline in deaths due to COVID-19. Now, those are the 2. That's for number 1. That's our first pillar. We've got too many Prince George's Countyans, Prince Georgians continuing to die from COVID. And our death rate is still hovering around 9 deaths per day, as the county exec said, and that has to start going down. Ideally, we would like to have less than 3 deaths per day, but we're watching it. Second, our healthcare system capacity. We must meet 3 measures. We must see a 2-week decline in our hospitalized COVID-19 cases in Prince George's County. That's 1. We must also have at least 30% of our med-surg beds available. In case if we have an increase, another surge, we got to have capacity in the med-surg beds. We also, number 3, have to have at least 30% of our ICU beds available. That makes sense, so that we can have capacity. We don't want to be very thin and then go overflow. Third, the third pillar, we have to have adequate testing. Now, currently, we're testing from all sources, not just from the health department, from all sources. About 5,500 of our residents per week are being tested. We need to be at least at 9,000 Prince George's County residents being tested per week, if not a lot more. But for reopening, if we can get to 9,000, we're going to be confident that we can get to the next stage. We need to increase our capacity, and we've been working extremely hard to do that. But we aren't there yet, as the county exec said. Now, as a reminder to our residents, the health department offers free COVID screening and testing by appointment only. First call our hotline at 301-883-6627. The 4th pillar, contact tracing. We've been working very hard and working with the state to be sure that we have adequate people who can track down those folks who come in contact with positive folks and be able to test them. That's contact tracing. You have to have a lot of people to do that. And we have been building our internal health department capacity. We've actually contracted with folks to help us. And we're working with the state, who has stepped forward to help allow us to be one of the first pilots in their virtual program that they're working with the University of Chicago. And we're going to see how that goes. But we have to keep very vigilant on this because it's one of our pillars for reopening. Finally, we have to have enough personal protective equipment and staffing at our hospitals and for our frontline providers, for our testers. They have to have the PPE and staffing, or none of this can happen. So those things have to be there in order for us to reopen. As our health department stays on the data and pushes for more test kits, we need all of you to stay the course, because without that, we'll go backwards, and that's something we just can't afford. I applaud all of you, though, for the outstanding job. Our residents have done an outstanding job in terms of mitigation. And I know the county executive has said this before, but even from the data that we see, you all have done a great job. So what we've got to do is we got to continue doing this. You've got to continue to be at least 6 feet away from each other. You got to wear your face covering and stay at home. You got to wear your face covering in particular when you're at the store and when you're on public transportation. COVID-19 is going to be with us for a while, but we don't need to go backwards. We can overcome this, as our county executive said. We're saving lives, so I want you all to be smart. I want you to stay safe. Thank you.
Good morning. I'm Congressman Anthony Brown. I'd like to first start by thanking our county executive, Angela Alsosbrook, for really leaning into the effort to manage through this pandemic. You've got an outstanding leadership team, Dr. Carter, the men and women at the public in public health, at the Department of Health, and your emergency management team. Congress has heard the calls of county leaders, of governors, and that's why tomorrow we'll be on the floor of the U.S. House of Representatives and pass the HEROES Act, which will include $1 trillion worth of federal aid to state and local government so that you can continue to provide the essential services, fire, police, health care, to meet the needs of our residents. So I want to thank you for your leadership. The only way to reopen our state and get our economy moving is based on science. And that's, as you've heard, testing, testing, testing. That's been our focus since day one. Just yesterday, Maryland received nearly $206 million to expand testing capacity statewide. The governor also announced yesterday that we've received the first shipment of swabs and extraction kits from FEMA. I'm relieved that Maryland finally has all the components that it needs. Now the administration needs to deploy them quickly to Prince George's County so we can test sites in our hard-hit communities. This is a commitment the governor has made repeatedly, and now he needs to deliver. Expanding testing was the cornerstone of Maryland's reopening plan. You heard today from the county executive, it is a cornerstone of Prince George's County opening plan. In fact, testing is the cornerstone of every opening plan around the country. But Maryland has yet to report 5,000 daily test results, well short of the governor's 10,000 daily tests that is our target and our requirement. Other states are meeting a sufficient testing threshold, but unfortunately Maryland has fallen behind. We rank 27th in the country for per capita testing, and the positive daily infection rate is still in the double digits. Yesterday, Maryland was second highest in the nation. Scientists say this means we are simply not testing enough. With phase one of reopening beginning on Friday outside of Prince George's County and other counties, Marylanders deserve full transparency on our current capacity and steps being taken not only to ramp up testing, but also to start doing the surveillance, testing, and contact tracing needed to contain the virus. And that's why tomorrow the House is going to pass the HEROES Act, as I mentioned, which provides another $75 billion for testing, contact tracing, and isolation measures, bringing the total to $100 billion to be deployed around the nation. This is first and foremost a matter of public health, even as the focus for some shifts to reopening and returning to normal, and one day we will do that in Prince George's County per the county executive's reopening strategy. I remain focused, as does the county executive, on the pain being felt in our communities right here in Prince George's County. It's my duty to give voice to the needs of my constituents, and it's my obligation to work side by side with the county executive to ensure we are doing our level best to ensure public safety and eventually get to the point where we can reopen the economy. Thank you.
Do we have any questions?
Any consideration given to opening a large facility, be it Showplace Arena or another facility for health, for new beds, that sort of thing? there been any sort of discussions about that?
We're going to stay the course. We are having discussions, of course, because we're trying to determine how we're going to, when it's time to reopen, how we're going to reopen. And the county executive and her team has been diligent about making sure that they meet with all the various people. But what we're doing now is what we're going to do for the next at least 2 weeks until we can see a decline and a steady decline.
County Executive, you mentioned you've spoken to your other colleagues, Big 8 counties, that sort of thing. What do you want them to do? A lot of decisions are still being talking with reps right now, and they don't know. There's been talk, and the governor acknowledged there is concern about people going across the line to open businesses. What do you want the neighboring counties to do? Where do you stand on that?
So all of the counties are unique. They each have different features, and each county executive has to assess the needs of that county. They have to assess also the information they've gotten from the medical professionals to make determinations about what is safe. We will be in conversation again today with those county executives, and we're going to have some discussions. But we do recognize the interconnectedness of our communities. For example, Montgomery County and Prince George's County, there's a lot of, our borders are porous. And we recognize, to be honest with you, if you open prematurely in one jurisdiction while another is closed, that means that very often individuals will simply travel back and forth. And so what we don't want is to have a jurisdiction closed, have a mall open somewhere, and have all of our residents somewhere in that mall before we believe that it's safe to do that. So we're having those discussions. Of course, each county executive has to make a decision for his or her jurisdiction, but I do appreciate them so much. They have been really wonderful partners. We are trying as best we can to make sure we have some consistency, that we've been really relying on each other a lot. We've talked nearly every day. I also received a call from the mayor of the District of Columbia yesterday, and she's been a phenomenal partner for us as well, has volunteered to share information that would be helpful to us as well. And so we're going to continue to work with all the jurisdictions, but the communication is most important.
Could there come a time when you still got some numbers that concern you, but it's gone on so long that you just feel like you need to move into stage 1 here for the sake of businesses, economy, that sort of thing? Are you going to hold fast?
We're going to accept advice from the medical community. This is a health crisis, and we think it's most appropriate to listen to our healthcare professionals and medical professionals who will tell us when this is safe to do. The point of the matter is, we're not closed because we don't care to open. We're not closed because we don't want businesses to open. We're not closed because we enjoy having people stay in their houses. I want to get out. Everyone wants to get out. But right now, 9 deaths per day say that it's not safe for us to do that. And so we are hopeful. Dr. Carter told us that we do have some hopeful information. We have seen that it's possible. It's not impossible for us over the next couple of weeks to see the kinds of declines and changes that we need to make it safe for us to move into phase 1. And that's the reason that we're urging our residents, who, by the way, have done a beautiful job on 2 fronts. One, they are social distancing and staying home. The University of Maryland's data tells us that we're in the top 3% in the country in terms of how social distancing has worked in our county using cell phone data. So we know that our residents are compliant. If they continue that, we believe that we will be able to safely move into phase 1, that we will be able to see the kinds of progress we need. As Dr. Carter said, you know what? COVID-19 is going to be here for a while. Nobody's saying that this is going to go to 0, although we wish that it would. We don't expect that in the next couple of weeks this will be eliminated, but we just have to get to a place where we can, in good conscience, say very truthfully to our community that we believe it's safe enough for them to move about and to move into phase 1.
Question, Dr. Carter. In terms of contact tracing, sir, how many do you think how much would the county need right now to be able to count the number of individuals to be tested?
Well, that number varies. Right now, they're saying that we need about 135 plus what the state can give us virtually from the University of Chicago. And that's a large number, and we will see. Because you can imagine how you do contact tracing. Every time you have a positive, it can be 10, 20 people that you have to contact. We've got 10,000 positives right now. So the rate is that according to the science, is that we will probably need about 135, but we could need many, many more.
Just have one quick comment, Brian. When you got word of the governor's decision, you were a little open about what you said, but with the state needs, especially Prince George's County, what was your train of thought?
Let me start by saying that, this pandemic is no fault of anyone's, right? It's not the fault of the president, the governor, or anybody else. But we all have a responsibility to manage through this pandemic. So whether that's outlining a testing strategy that supports our counties, whether it's ensuring that families whose rent has come due and mortgages have come due, so they need that unemployment insurance check now and not 6 weeks from now, or whether it's addressing hotspots like in our nursing home, as the governor promised, you've got to manage through the pandemic, and you've got to be candid with Marylanders on your capability, the progress. The county executive and Dr. Carter laid out some very precise criteria for opening up the economy because they're exposing themselves to accountability. And Prince Georgians and Marylanders will be able to measure that progress. And if we don't make progress, we'll know what resources we need and what don't need, and where we're already strong. So my concern has always been, as you manage through this, be candid, have a strategy, and be willing to ask for help. If I could just comment briefly on balancing sort of opening up with the need to open it up for businesses versus public health. Surveys show that that consumers, that people, they're not interested in going back to businesses until public health officials can assure them that we've got this wrestled to the ground. Infections are going down, deaths are going down. So if Prince George's County were to open today, you might see a mild interest in going back to restaurants and gyms, but until Dr. Carter and County Executive Alsobrooks can give a thumbs up and say, hey, it's really safe to return, the economy won't rebound anyway. So it's a prudent course to keep it closed, not only to drive down infection and death, but it also acknowledges where most people are anyway. They're not interested in an economy opening up if it's not safe to go to the store.
The governor dismissed yesterday your requests for test kits as confusion on your part about what actually gets sent out. I assume you're familiar with the governor's comments
Yes.
yesterday. What's your reaction to that?
This isn't about me or the governor. This is about Prince Georgians and Marylanders. And right now,
Were you confused about what?
no, I'm very clear on what it takes for a test, right? You need to have the swab. Several weeks ago, we asked the governor, do you need more swabs? And we didn't get an affirmative response because we were ready to go to FEMA and jump up and down on the table and say, send Maryland more swabs. He didn't make the request then, but fortunately, we have them now. So Maryland is testing. The goal, the target is 10,000 a day. We're doing well below 5,000. That's dangerous to open up an economy without sufficient testing. You've heard that from Dr. Carter. Prince George's County has made the request for support for testing, and it's my hope that the governor will fulfill those requests, support Prince George's County, so we too can get to a point where we can open up our economy.
One more thing. The governor's press secretary has just said, it's been relayed to me, that Prince George's County has not requested any PPE from the state. Is that true?
Unfortunately, it's not true. We had a really productive conversation with a member of the governor's cabinet. Again, they've been wonderful in terms of reaching out to us, and we had a conversation where we discussed the fact that we needed certain things: PPE, contact tracers, testers, and we followed up with a letter, actually memorializing that request. And again, you know what? This is not about blame. I have a county with nearly 1 million people who would like to get back to work and like to visit with their families again. And so we are very willing to continue to work with the governor, our federal partners, and anybody else who can help us do so safely. So again, I don't have any time or interest in blaming anybody, but what I do need is for us to have those resources so I can say in good conscience to the people here who trust me that it is okay, safe, for you to go back into these spaces, and that's all we need. And so we'll reach out again. I'm sure that the governor and his administration will get us the things that we need over time, but we just need them sooner rather than later. If we're told to open by tomorrow at 5 p.m., of course, we can't do that, but we would like to participate too. And to do that, we need the support that will make it necessary for us to do that safely.
Okay, thank you, everyone.